Shall we start? So, good afternoon, everybody, and thank you for joining the webinar today. Really excited to have this opportunity to have a sneak peek at some of our new products here that we're working on here at Nourish. We're really thrilled to see the amount of people that have joined the webinar. It gives us a massive motivator to know that our customers are keen to know what we're busy working on behind the scenes. Many of you have been involved or will have heard already, so this is a really great opportunity for us to showcase some of the great that we're working on. So just as a quick intro of your Nourish team today, he's going to be presenting. So my name is Paul Andrews. I'm the head of account management here at Nourish. I'm also joined by Mark, who's heading up on the safety product. He's going to be talking you through the interesting work we've been doing around event management. Amy's also here. She's our product lead for the Transparency project. So another really exciting piece of work we're working on, looking around dependency. And she's going to be supported by Paul, who's been key in helping the design and facilitation around transparency. We've also got some special guests that we're going to reveal along the way who are going to be chipping in and putting some colour on the palette as we go through. So we're going to go straight into it. But just before I hand over to Mark, just a bit of housekeeping. We're really, really keen to hear everybody's input, your questions along the way. So we've got a team on hand to answer your questions. But please can I ask that you use the Q&A button, not the chat button. If you use the chat button, we won't be able to see your questions. So please do pop them in the Q&A box and we'll respond to your questions throughout the session. And at the very end, we'll spend a little bit of time looking at some of the questions you've asked and answer them together on the call. So I'm going to hand over to Mark, who's going to walk us through Nourish Safety.
Thanks, Paul. So I'm sure everyone didn't come here to hear me wittering on about why we're building this product and how we've built it. But I did want to just spend a couple of minutes on that, but don't worry, we do have a meaty 10-minute video of the actual product, so you're going to see plenty of that as well. But we set out on this journey over a year ago now to kind of invest in our incident management capability, and we went out and we spoke to a load of customers to understand really what incidents meant for them. And a lot of this really is stating the obvious, but what we found was that incidents impact the whole organization. So from the people that you support, obviously there's a pretty unpleasant experience. These incidents or these events tend to be things that they don't want to happen to the person. They slipped, they tripped, they fell, they got the wrong medication. And also obviously their circle of care, their relatives, you know, these are not good things that are happening for them. For your care teams, what we found was obviously it caused a lot of unplanned care, which added extra load to an already stretched workforce. And then for the entire organization, having these events, these incidents are essentially bad for business. They lead to loss of revenue, poor inspection results, or potentially worse consequences than that. And I think what we also found was that as a result of this, and it sounds obvious, but everyone is doing pretty much everything that they can to reduce and prevent incidents wherever they can. The thing we also found was that actually the existing solutions make this really hard to do, and that is whether you're using Nourish's existing capability with incident management, another kind of standalone product, or good old-fashioned pen and paper. We feel that what we found was that there were lots of problems that people had, which we find here. So underreporting was a really big one. People found that actually of all of the events that happen, a lot of them don't get recorded because it's too hard to do. The data can be really hard to explore, and evidencing this is not always straightforward. And to a greater or lesser extent, what we believe is that these things happen essentially when you've got all of your care and your care data in one place and all of your incident and event management somewhere else. These problems are kind of fairly hard to avoid. And so what we then really set out to do was to build a product which allowed this and had these kind of three core aims. So one of them was to remove those barriers to logging incidents. So by making it fully embedded within Nourish, and making a really fast and intuitive event capture experience, which hopefully you'll agree we'll see, we believe that a greater percentage of the incidents and events that happen will be logged and therefore can be learnt from. We've tried to encourage best practice kind of throughout the product. So we have these pre-configured event pathways that make sure that the right care is administered for the person after an event happens, but also that the right kind of administrative processes happen afterwards, so that that learning cycle is kind of enforced at every opportunity. And finally, that really focuses on capturing and surfacing that data and bringing that to the forefront, so that it's easier to spot those patterns and trends, so that actions can be applied, and ultimately that these incidents and events can be reduced or even prevented. And obviously the outcome of this, what we think this is going to mean for your organization, is better outcomes. So better outcomes for the people you're supporting, but better outcomes for your whole organization as a whole. And just to say on kind of on one point, one of the other things that we found was that obviously pretty much everyone already has an event life cycle that they're following. So what we didn't want to do, or didn't believe we needed to do, was to reinvent the wheel here, but rather build the features and the capabilities which help support that existing event life cycle. So we have our event life cycle in the middle there, and around the outside there, some of the features of Nourish Safety, which we're going to jump into a video of now. And if I can seamlessly look to share my screen. Please, my fellow panelists, jump in and tell me if I'm sharing the wrong thing. I see a thumbs up from Paul, and here we have our initial recording. So starting here on the mobile app, and the reason for that is we think actually this is where the majority of events are going to be recorded from. Because they'll be recorded by the carer at point of care, because we've looked to make it so quick and intuitive and similar as possible to recording planned care. So we're here on the timeline, which should be familiar for most people. There aren't any changes here. But what you will notice is after we click the blue plus, a new option, which is to record an event, incident, accident, or near miss. What we've tried to do here with this initial event capture is allow the carer to log the bare minimum details required initially. So that would be the date and time, the event type itself, and the severity, so that they can come back later and add more details, but in the short term focus on the individual that they need to look after. So you should see a big long list of potential events here. We want people to be as specific as possible. But these are grouped together in the background for kind of data and reporting purposes. The one we're going to look at today is a distress reaction event, but we do have over 30 pathways that cover kind of all manner of different events. You'll see some guidance for the carer there on severity. Just to make that bit easier, it is worth noting that the severity can be changed and updated later on when more information comes to light. And we do think that this event capture can be done in 30 seconds or less, and obviously with the carer then coming back later to add more details, as we will see in a minute. So switching over to the web view now, and what we'll see on the timeline here is a number of new interactions that have been generated as a result of that initial event recording. And this is what we refer to as an event pathway. They come sort of pre-configured within the system. They're designed to make sure, as I said before, the individual is looked after, but also that the correct life cycle of that event is followed, so that actions are logged, that lessons learned are logged, that things are escalated where necessary. Coming now to another feature is the event view. So previously we were looking at Alan's timeline. The new event view for safety customers kind of groups all of the interactions related to the event in one single place. So you're not looking at them kind of just in the timeline amongst all of his planned care. So here we have some of these interactions for this event pathway. I think the first one we will look at is the event details capture. And I guess what we believe is that because that initial capture is so quick, we can afford to be much more detailed with this form. So we've tried to go into as much detail as possible to record all of the information about the event, because we think that more data means kind of more opportunities to spot trends, which then can be used to take actions to reduce and prevent further incidents. In this particular pathway, we have a post-restrictive practice physical health monitoring. PBS has been a really core focus for us from this product, kind of right from the beginning, as we've hired into the business people with behavioral care backgrounds, and we've worked really, really closely with some of our customers to make sure that we're working to that care type. One of which, hopefully, we are going to hear from later today. And so we fast forwarded a bit here, and we can see kind of what some of those interactions look like after they've been filled out. So the first one that we'll look at is a huddle. So we spoke to a lot of organizations and found that a lot of them like to immediately do this kind of huddle after an event happens to log those initial findings of what went well, what could have been done better. Onto the event details capture that we looked at before, this time filled out. I think the thing to point out here is that kind of based on the answers to some of these questions, other interactions will have been triggered. So for example, in this one, we can see there's a question about whether you want to ask for witness details and record those separately. I clicked yes to that, which meant that a new interaction for recording those witness details was created. Here is that witness details one, and an opportunity to see another safety feature, which is confidentiality. So confidentiality allows people to raise interactions confidentially, which means that only those people with the right permissions as defined in the system can view the content of those interactions, which is obviously really useful if you have something with sensitive content that you don't want absolutely everyone to see. Sorry. The last one to look at would be the triage review investigation. And this is one that you would fill out later on in the event lifecycle to make sure that the event was handled correctly. That's a reflective thing. So were sufficient witness statements created? Was a policy in place? If so, was it followed? Are there support plans that need updating? Does this need to be escalated to a regulator? So on and so forth. So we're not going to go through all of the events in the pathway. Instead, we're going to switch over to our new Safety Event Explorer dashboard. So the thing to call out here on the dashboard, apart from the high number of incidents that we've got in our test environment, we're obviously not on our way to an outstanding rating. The KPIs across the top there, which our customers said were the most important. The date filter there that we saw employed, you can filter over any time range you want. There's no limit at all. The graphs in the middle can be we can use those along with these slicers down the middle, so you can kind of dig into those KPIs in more details and see how they trend, for example, over time, or how they trend across services, or any of those kind of criteria. And there's also these overall filters, so you can filter the whole dashboard for things like the severity, for the type of incident, for almost anything that's related to it. And once you have filtered these, kind of sliced and diced the data as you want to better kind of see those patterns and trends, the list down the bottom there gives you a list of all of the incidents that match that criteria. And so you can see that headline data there. And there's also then a link to them in the platform, so you can go back into the platform and see that event and any of the care that happened both before and after to understand it better. Last thing to call out there is there's a help article embedded in there just to help you with those kind of using those filters. Anyone trying to spot the event for Alan wouldn't have seen it in the dashboard because they run on a bit of a delay, but not the case for our event tracker, another exciting feature with safety. So this is a real-time view of all of the incidents across the organization. Again, this can be filtered and sorted by these various different criteria. Perhaps you only want to see ones that are in progress or new. Perhaps you're only interested in ones of a certain type or a certain severity. We think this is going to be really, really powerful to have this real-time view of the data, and it's something that came through in our conversations with customers as being really important. It has to be up to the minute. So we're now going to use that to try to find the one that we used, the event that was created at the beginning of the video. You can ignore those labels. We still have a few rough edges to iron out. here we can see our event that happened to Alan. The ellipses there offer a couple of follow-on options, one of which is to create a report, which brings us on to our next feature, reports. Tickety cough. So here, just creating a report for the event that we created right at the start of the video, just popping in a title there. You can select the incident or the resident that it happened to. Obviously, it's pre-filled here in this instance because we came from the event tracker, but you can change those. You can change the data that goes into such a report. And you can obviously choose the format that you want to have that report in. So we think these reports are going to be really useful if you want to, for example, print off everything that happened, or perhaps share it in an email with someone that wants to know all of the care that happened with regard to an incident. And this is what one of those looks like. So this is our event for Alan, obviously in PDF format. We have all of the interactions and all the things that happened to him in that report. Moving swiftly on to email notifications. I can't show you the emails, but what we found from our customers was that they didn't want an all or nothing approach. They wanted to be able to set certain people to be able to see certain events based on the type of event or the severity. And that's exactly what we can see here with our PBS lead role set up to only receive emails relating to certain events. And then the final one to look at, very similar to our event tracker, but is our Behavior Explorer dashboard, which is basically just for our PBS customers. There's a few things that are different there. There's some different KPIs, and you can filter down to a person level, which we think is really important for this care type, where you're more likely to have multiple events affecting one person than in others. And there is even a page there that gives data specifically for restrictive practices in terms of how many they were applied, how long incidences duration lasted for, and so on. That was a bit of a whistle-stop tour of safety. I hope it was useful. Please do get questions into the chat. Before we move on to transparency and start hearing about that, we do have a special guest on the call, so hopefully Anna is with us still, who I just wanted to ask a couple of questions to, really, if that's okay, Anna.
Absolutely, yeah. Hi, Mark. Hi, everybody.
Fabulous. Thanks, Anna. Thanks for coming on. I guess I spoke a bit there about kind of trying to co-create this with customers. Obviously, you at IBC were one of those key customers who helped really shape this product. I was hoping you might be able to just say a couple of words really about how you found that experience. Do please try to be kind.
Absolutely, yeah, definitely. So IBC were invited to take part in the early adopters program for Nourish Safety. So during that process, we attended several engagement sessions. Some of that was face-to-face, some of it was online, and probably one of the most key points to mention as part of that process was that as a provider, we felt very listened to about what we felt that we needed from this product. And for us as a provider, it was sort of like all or nothing really in terms of our investment into that process, because we were in a position where our current platform absolutely was not meeting the needs of what we needed, and we were very much interested in going on this journey with Nourish. So absolutely, we felt very, very listened to for the requirements that we had, and were regularly engaged with to get more clarity, feedback on that as well. So it wasn't just a case of, here you go, this is what we're after, but actually a number of people from Nourish were coming back to see, okay, well, what does that really mean? What does that really look like? This is what we think that looks like. This is what we're proposing. And as the product was developed, we were engaged with reviewing that, doing an element of testing as well, prior to us rolling that out. So, overall, in summary, we found that the process was enjoyable and really, really useful, and it absolutely reassured us that this product was going to meet our needs before we even got to the end product, really. you know, we were kept engaged throughout. So, you know, top marks for the early adopters program from you guys. Thoroughly enjoyable. And what was also really important for us is that it wasn't just myself as one person representing our organisation, but a couple of our other colleagues also, including our PBS lead, who also provided, you know, extensive input and, you know, examples of things that we were looking for, because we support some extremely complex people in our business. And as I said before, you know, our current platform was absolutely not meeting the needs, and we needed to make sure whatever we were using was going to meet the needs of our business and to essentially meet the outcomes of the people that we're supporting.
Yeah, that's really nice to hear. And I want to just say a big thank you to you for the help that obviously came from your guys to help shape this product, and really excited about that. And hopefully you're excited to start using it.
Absolutely.
Is there any particular thing that you're particularly excited about, perhaps a specific feature or an outcome that you're hoping Nourish Safety will help IBC achieve?
Yeah, so we've just started using it this week, only a couple of days in, so you know, we haven't got a lot of live data yet to be able to really review. However, one of the things that was really important for us is to be able to have an incident with a review completed with a debrief attached to that. At the moment, it was a weakness that we identified in our business in terms of capturing the detail of that, but also having those things linked together in the same place, which we didn't have. So that was, yeah, that's one feature definitely we were excited about. I mean, there's so many really, but I think overall this is going to improve outcomes organisationally for us and for the people we support and our workforce. So specifically what I mean by that is that organisationally, I'm confident that we will be able to have a faster paced approach to reviewing and managing incidents and other events as they happen. We will, as you mentioned, it's in live time, right? So we will get to know about them much more quickly than what we are doing now. So we can then work on analysis and trends and patterns much more quickly. It will feed into our other internal processes like serious incident reviews that we facilitate, so we can address that much more quickly. And then for the people we support, essentially we can analyse the patterns and trends whereby we can make changes one quicker, we can identify them much sooner, and essentially provide them with the care that they need, including review of any ways of working. And then for our workforce, one, it will provide them with timely support and effective support in terms of the debriefing process, but also from a usability perspective, this product breaks it down in a way that people who are delivering that support can more quickly report concerns, and also in a way that they feel that they can offer the detail. So specifically, when you've got a free text box, often staff are unsure. You know, they're in that moment, they're on shift, they need to get the detail down, and they've got a mind blank. What am I writing here? And in Nourish Safety, you're not going to encounter that problem. You know, it's really very detailed. It's broken down in a manageable way, so people are able to use it effectively. So yeah, so many aspects there that we're looking forward to and are confident that are going to bring positive outcomes for us.
Well, great. That's lovely to hear. And thank you so much for your help throughout the whole process in shaping the product, and for coming on today to talk about it. We really appreciate it. Thank you, Anna.
No problem. Thank you.
Great. I think now I'll hand over back to Paul, and we'll start talking about transparency.
Thanks, Mark. A really big thank you to Anna for joining the call today. For everybody on this call, your feedback's really important to us. We take every bit of feedback that we receive really seriously. We use an internal system for logging and recording, and that's how products like Safety has been born, and we will continue to liaise with you. So it's really great to hear feedback from Anna on how they've been involved in curating and helping us to shape safety. So we've heard from one really exciting product. Let's talk about another one. So really pleased now to talk to you a little bit about Nourish Transparency. It's a new development that's really close to my heart as a social care provider previously before working for Nourish. It's something that's really impactful on people's lives and really puts the person in the centre of their care. So I'm absolutely thrilled to invite Amy to take the reins. I'm just going to hit share, got a couple of slides to go through. Over to you, Amy.
Great, thank you, Paul. So yeah, hi everyone. Thank you so much for joining us today. I know how busy things can be in care, so really we do appreciate you taking the time to be here. And yeah, let's introduce Nourish Transparency. So we're going to kick off by sharing some of the challenges that we're hearing. And something that's come up time and time again in conversations we've had is this challenge of providing quality person-centered care despite staffing pressures and lack of funding. So care providers have shared with us that they don't always feel confident taking on a new person because they don't always have the full picture of the care needs. And this can create some uncertainty around having the right staff and skill sets to fulfill that care. Now, equally, we also know that a person's care needs can change over time. And so without the right insight, providers are left feeling reactive, unable to plan ahead or adapt quickly. And that just makes it really difficult to deliver the truly person-centered care that they want to. We know that as care providers, you really do want to provide that right support, and that it's actually quite difficult to do that and get in place the right resources when evidence in any change in care needs is difficult, it's time consuming. And obviously add to that the macro changes that can also feed into this. So changes to minimum wage creating additional costs, while staff shortages are creating more reliance on agency staff. So a lot of different outliers really feeding into the difficulty there. Quality of care is therefore at risk, and the need to have a clear real-time understanding of care needs and what their impact is greater than ever. So before we kind of go into transparency and how we look to solve that, I'm going to hand over to Caroline, who has joined us as Central Operations Director at OSJCT, just to share a couple of her thoughts and experiences on these challenges.
Okay, thank you, Amy, and it's lovely to be here this afternoon. So my background is in care, 33 years, almost in care, starting as a carer and being a home manager and now into a senior operational manager's role. And we see sort of first-hand experience of the amount of challenges that we do face, that when we are looking to evidence sort of how we care for our residents and the dependency of our residents. And no doubt most providers on this call have shared similar stories or experiences, that we often find that when we're going out to do assessments and can be time consuming, that at times that we find ourselves underfunded against those assessments that we do, unable to demonstrate the full extent of the care that may be needed, or delivering resources required to sustain the staffing levels that we might need. The dependency of our residents that we see now, today, moving into our homes, are changing rapidly. They're typically arriving with a much more higher dependency. They're more frail. Often we find that we'll be told that they can manage with one support, and then once they're into care, it's more two. And it really is difficult when you're trying to demonstrate that you can meet somebody's needs when you're not getting a really in-depth assessment carried out. And I think with residents that we have today, also when it comes to reassessing their needs, changes in their needs, we are seeing that the greater proportion of these are much higher and the needs are growing continually. So having been involved in working on Nourish Transparency and the way it's been developed, we truly do believe that this is, for the first time, from all the different tools that we've seen over years, and I'm sure many have seen different things, got different systems, but never anything that really does sort of give you a breakdown of where their needs are being, what the cost of those needs are, absolutely highlighting the staffing needs that are going to be needed to have the residents there to support the residents the most. We're really confident in the fact that this feels like a real game changer, and it's been a pleasure so far to work with Nourish to get to this point of getting something that is absolutely going to be able to help us evidence sort of the residents' care needs to ensure that we will be able to identify the correct staffing and the skills mix that we need and highlight the true cost of care, and more importantly will help us ensure that our care plans that we have for our residents are truly reflective. So it's been an amazing sort of first few steps getting to build transparency.
Thank you so much for that, Caroline. Really great to hear from you on that. So yeah, let's maybe dive into the product a little bit. So the Transparency product aims to improve care outcomes, personal to each individual through sustainable care. And we've broken down the value of that into 3 steps. So it starts with our assessment, which enables you to quickly map out how much time each care need will take, so you know what's really required right from day one, and that you've got the right team to deliver it safely. Next, you have access to real-time care costs, staffing gaps, funding risks, and this is all shaped by the evolving needs of each person, so that you always have visibility of how those evolving needs impact and can therefore adapt quickly and keep care right. And then finally, we've also included the ability to quickly generate reports that show the care you're providing and how needs are changing, so that you can back up one-on-one care or funding requests with trusted data. So that's a little bit of an overview. We're going to actually now take you into the product and show you step by step how that all works.
How you get a clear, structured picture of someone's care and support needs from day one. What you're seeing here is a simplified version of the assessment, just enough to show the flow without going into every detail. In practice, this gives you a real time-based view of the support someone needs across all the key areas right from the start. It's designed to feel really intuitive, and when I first jump in, I get this overview screen UI that tells me how this works, what I can expect, and what the sample of the output is going to be. As I dive into the assessment, I'm presented with some broad support domains that help guide meaningful conversations so that you can focus on what matters to the person. So here, the simple question, does this person require any support for cognition and mental capacity? And I can say yes. And then as we walk through each area, you're recording not just what kind of care and support is needed, but how often and how long it typically takes. A simple slider lets you set the expected duration. And so the picture you're building actually reflects the person's day-to-day life. So in this case, I can say, well, this is going to be about 10 minutes, and we're going to do this maybe 3 times a week, and it's just going to be one person. For decision support, that's something else that this person requires. It's only minimal support, but actually it happens quite a few times a day. So I can move on to the next section. For continence, yes, this person requires catheter care, and actually it takes a relatively long time to do, let's say 10 minutes, and happens 3 times a day. But I don't need a pad check or stoma care. For nutrition and hydration, yes, the person requires mealtime, and that's going to be 3 times a day. And we're also going to offer a snack. Just a minimum amount of support, and we offer a snack twice a day, 1 person involved. My last step here is I'm going to add a funding package of £800 a week, and also it's going to ask me whether I need any dedicated background support. So this would be whether the person maybe requires 1-to-1 or 2-to-1 support, or even higher ratios throughout the waking day, and then just defining what that waking day period looks like. So the result is a clear, time-based picture of what good support looks like for this person. Because it's built on Nourish, it's not a separate tool, it connects directly to daily practice, staffing decisions and funding visibility. You can see here at the end of the flow, I can see the estimated cost of delivering this care, and whether that's within the person's funding. It makes it easier to make confident, informed decisions about whether your service can safely meet the needs with the funding that's provided. And before we commit the assessment, I can jump into any of those and maybe modify this slightly if there's something that we haven't quite captured, before I then submit that assessment. So what you're seeing here is just a core set of activities and a cut down flow, but you can also add your own if needed. So we treat custom interactions the same way that we treat interactions within the library. So the assessment reflects how your service actually works, but that flexibility is there in the background. You don't need to configure anything to get started. Most importantly, this isn't a one-off. Because it's so connected to the interactions that happen every day, this becomes your baseline, shared understanding of someone's needs, which you can refine over time once you're seeing how care is actually delivered. Right? Transparency is built for the individual, not the average. Once someone's care needs have been assessed, the next step is understanding what that means for your team. Transparency translates individual support needs from the assessment into total staffing requirements, giving you a live, person-led view of how much care and support needs to be delivered and by whom. The establishment view gives you a clear weekly breakdown of hours needed for each staff role, support workers, nurses and managers and so on. And we'll be adding shift left visibility too, like day and night staffing. So here I can see, based on the current assessments, I have the people that are using the home, so Margaret and Clara, etc., and the total number of FTEs they need to support them across a week. If I wish, I can jump in and see more detail. I can see exactly what those are made up of, what those care and support needs are made up of. And I can also see on the total, I can break that down so I can see what that looks like as the split across the different roles that I have within the home. What this means is managers no longer need to guess or mentally juggle how many hours they're going to need to staff safely. It's calculated automatically straight from the assessments, which are connected to the interactions that happen on the timeline. So there's no extra admin, no spreadsheets to maintain. It gives you a snapshot you can rely on, not just for rostering, but for recruitment planning, justifying changes to headcount, or spotting where capacity may be already stretched. The goal is really simple: reduce the mental load, eliminate the guesswork, and connect it to reality to help you make more confident staffing decisions. Once you understand what care is required, the next question is whether you're funded to provide it. And that's where the funding view comes in. It gives you a clear, reliable picture of the actual cost of delivering care in your service, built directly from each person's assessed needs, mapped to roles, matched against real unit costs. It's not based on assumptions or averages. It reflects what your team actually delivers week on week. So here I can see the funding view for all the residents within this particular home. And I can also sort these so that I can really quickly understand where a person's cost of care is starting to escalate past their funding, in this case, quite extremely past their funding. When I click on the little box here, I can then get a breakdown of what that looks like and which areas are contributing the most to that particular person's funding. Many managers already try to track this, often manually across spreadsheets or budget trackers. What transparency does is take that burden away. The calculations happen instantly, straight from the assessment, so you can spend less time on admin and more time acting on what the data shows. It also helps to build a paper trail, not just for audits or inspections, but for funding conversations. You can evidence exactly how needs have changed because this is based from an assessment and connected to interactions. It doesn't magically solve funding gap, but it does make it visible consistently and clearly and gives you the best data possible to go into those conversations with confidence.
Great. Thank you for sticking with us through the demo. I think just having worked, with a couple of customers on this, actually, it's really interesting to see how we can shape this product to solve some of the challenges. But again, I'll kind of hand back to Caroline to just talk us through, what do you feel the benefits that transparency will bring are?
Thank you, Amy. So I think for anyone just seeing even just that demo, a lot of us do work probably in old Excel spreadsheets, or when you go into out to do assessments and you're trying to compare those against the needs of the current residents, it already is a sort of time and game changer to be able to see all residents in the same place to certainly instantly highlight, actually, can we meet those needs? Because of the residents that we already have living in our services, to know that we can meet their needs. So for us, it really is about evidencing, pulling the data together and ensuring that we will be able to say that we can meet residents' needs and absolutely know the staffing levels that would be needed. I think the greater point when you look at the demo that was just shown also is around, whilst there is, from a local authority point of view, sometimes lots of challenges that lots of services no doubt have. Absolutely, in the past when things have been on paper, it's so much harder to evidence. But actually, when you look at transparency and you look at how it's just presented there, the data itself is not, it's not a lie, it's telling us exactly what the needs are. So we really do feel that it is going to be a real change for us, certainly around getting continuous care, being assured that all residents' needs can be met with the right staffing levels. So in general for us, sometimes we do several annual reviews of the dependency of residents to make sure that the changes are being identified. Again, from using transparency, we can see instantly that we won't have to do those real in-depth reviews, get either paper systems out or Excel sheets to go through and work through them. As we're updating them, we're instantly going to be able to start to track, and you'll start to pick out that actually somebody's needs have changed on an ongoing basis, rather than where sometimes it can be a short-term basis, which could be due to a recent illness and infection. So again, it's absolutely just highlighting firsthand where we can pick up changes and ensure that we're continually making sure that our residents' needs are being met and we have the appropriate staffing. We'll also be able to identify the true cost of care. And I think Paul's just covered really well. Like providers, we find ourselves doing care assessments that we undertake reassessments, we talk to local authorities, and we generally get rejected based on the lack of evidence. The way that transparency is working, it is giving you that evidence. And although that was only a sort of a whistle-stop tour into the system, having been behind the scene, you can start to build the blocks of care. It builds that journey and that story. And a lot of the times they want an ad hoc picture, or they'll ask for a life of the resident in its last 24 hours, where sometimes that's really hard to capture. Transparency gives us that, so we have that information firsthand. And I think it just makes it so tight and concise that actually every time there's reviews that we'll need doing, they'll always be seeing the same information, and it's dated, it's up to date, and it's showing ideally the needs and the changes that go on. It builds overviews reports that we'll be able to show average time for certain tasks. Often in our paper systems, we sort of estimating the time, but with transparency working alongside Nourish, it links in from the time you start the task to the end of the task. So again, just absolutely backing up the pure care time that is given to each and every resident. I think more importantly for me, having had so many years across care and many challenges and discussions about ensuring you get the right fees for carers, being able to show exactly that it's more holistic. It's about the whole resident experience. Many a time I can be in a care home, I can speak to managers where they really, really struggle to be able to evidence an example where we've got dementia services. And for a lot of our residents in the afternoon, they could be seen walking with a purpose, but to them at that moment in time, what they're walking around and what they're looking for is really, really important to them. And the fact that it could take somebody 5-10 minutes at that moment in time, it's really important that that resident gets that time. But sometimes you can't evidence that. With transparency, you can. And that gives me the confidence to feel that actually we are going to be able to have really great data to be able to share that shows the time. Lots of people focus around dependency needs on personal care, mobility, eating and drinking, but actually it's that resident as a whole purpose that you're going to see that whole journey, that life experience for that resident and the time it takes. And that is the times where homes do struggle to really evidence that, but transparency is going to give that. So for us, that is a real benefit and something that we're looking forward to embracing moving forward. Also gives us that second check to know that the care plans are absolutely bespoke to the residents and individual needs. And that often what we do find is over the years, every year we have an annual fee increase. And often some of the questions we get back from that is around wanting to understand the breakdown of what the care is cost, what we're paying for that care. So whether that's a self-funded resident, whether it's a local authority, transparency in the way as Paul's demonstrated there starts to break that down. So again, it's not having to go away and not be able to be straight away able to evidence that to a resident's family or their next of kin. You've got the information to hand. So I think what it sums up to us that it builds on everyone's desire to treat everyone as an individual, and this tool means that we can get more help to truly identify individual needs and preferences and build a package that's specific to any resident that's living in our care.
Amy, you're on mute.
Just realised, sorry about that. Yeah, thank you so much for sharing your thoughts on that, Caroline. It's been really, really great working with you on the project, and yeah, we're looking forward to getting it out there. So with that, I think, Paul, I'll hand back over to you for any questions.
Thanks, Amy. Thanks, Caroline. Thanks, Paul. Caroline, I had multiple spreadsheets, the most unperson-centered approach to assessing care you've ever come across, and I had different ones from different local authorities. It just felt gross. I love this approach. This person-centered avenue is it should have been needed years ago. So really excited, and thank you for being so open in your comments there. Hey, you've all been great. We've had some fantastic questions coming through on the chat. I think the team's fingers are all falling off from quick typing. So thank you. We've been busy collating as we've been chatting as well. There's definitely some trends that are creeping out that people are keen to know. So I won't go through these in any particular order. I'm just going to go through them from the top. There was lots of people asking similar questions around when we're looking at safety, around how configurable the different interactions and different workflows are. There was quite a few people asked the same question. So, Dan, are you happy just to jump on and just to pick that one up for everybody on the call, please?
Absolutely, thank you very much. I've tried to answer all of them, but I'm going to summarise because probably lots of people are thinking lots of similar things. Customization has always been brilliant in Nourish, and we've been keen to maintain that for the safety product. So to answer a few of them, yes, you can call them incidents or events. You can customize that term. There's definitely a preference per organization. Yes, you can hide questions that are relevant to your organization. Yes, you can add extra questions into those interactions. Yes, you can hide preferred terms in sort of the data items in the lists. So if something you don't like is in that list, then you can remove it. Or if it's a particular incident type you don't want to capture in this way, you can remove it. And yes, to the reports, you can customize the report. I don't know if anybody spotted it in the demonstration, but you can choose what you include in those reports as well, and lots more customization.
Very thorough. Thanks, Dan, for picking that up and covering those off. Really, really useful to clarify. We've also had some questions around, well, sticking with safety, around the requirement of that quick initial interaction to gather information, and why that's needed. So, Steve, are you happy just to come in, just talk the principles around that, please?
Yeah, of course. Thank you, Paul. So yeah, one of the really important things about the Nourish Safety product is to address one of those pain points about incidents just not getting reported, and recognizing that your team are often very, very busy. When an incident occurs, it's possibly the last thing on their mind to go and record any information in the platform regarding that particular incident, recognizing that sometimes it's actually quite a lot of information that they need to capture. So we've deliberately introduced that very quick interaction that Mark highlighted earlier on that takes about 15 to 20 seconds to complete, to ensure that the incident is captured as close to the time of occurrence as possible. And there's a number of reasons for that. The first one being that often, if that's not done, then by the end of the shift, perhaps it can get forgotten and that person goes off shift, and then perhaps that incident isn't reported at all. Also, what we do by having that very quick interaction is to trigger the appropriate capture form. So we're recording all sorts of different types of incidents, It may be a behavioral incident, it may be a fall. When you're completing your capture form where you're going to be recording that detail, you want to be recording the appropriate information according to the event type. We're also triggering certain care pathways. So again, recognizing that in that moment, if somebody's had a fall, probably you're not going to want to go and complete your capture form, but actually perhaps you want to do a post-falls assessment. So we will trigger those care pathways as, straight off the back of that initial capture form. And then I guess the final thing to call out on this is that because we now have configurable notifications set up in the platform, you can set up your notifications according to what your particular role needs to know about, or what any role needs to know about at a particular moment in time. And that feeds off that initial interaction. So as soon as the incident has occurred, to quickly capture it in the device, 15, 20 seconds, get it recorded. That not only triggers the event specific forms, the care pathways, but also notifies the appropriate person right at that moment in time. So if you've had a severe incident and you've set up your notifications to hear about severe incidents, you will get that notification straight away.
Thanks, Steve. That's really clear on why that's so important to do that immediately. Thank you for talking us through it. Moving questions over to transparency now. So we've had a question around, so those of you that are using Nourish will know there's the needs assessment baked into the platform as part of the needs assessment journey. There's a question on the chat, Amy, about how that links through into transparency. Would you mind picking that one up, please?
Yeah, absolutely. So on our first release of transparency, the assessment will be separate. One of the reasons for this is we do want the assessment to be quite quick and seamless and give you that insight of the care need and impact quite quickly. But that said, we realise the impact of being able to utilise that data as well. So something that we're thinking about at the moment is, do we make it part of the needs assessment itself, or do we simply allow that data available to feed in to reduce the time on the needs assessment? So yeah, absolutely something that we're thinking of on the roadmap.
Thanks, Amy. And sticking with transparency, I'm going to read this question out verbatim. Transparency is very cool. How does it link to interactions? If you assess as two-person care interactions a day and actually deliver 4, how will we surface that data? Paul, how would that happen, please?
Yes, it's a great question, and there was a lot that we would have liked to show today that we couldn't. So I would say that way the assessment's built is it is directly linked to the interactions that come out of that. So there are some new bits in the background that we're building to create those connections. So if you're exactly like you're saying, if you're assessing for 2 personal care interactions a day and actually deliver 4, that will be shown through insights. And also back in when you go to reassess, you'll be able to see that data point. So you're reassessing from a place of knowledge to be able to see that variance there. So yeah, it's a great question, Michael, and yeah, that's really what we're looking at for that one.
Cool. Thanks for the question. Someone's asked the elephant in the room question, Amy, and I'm going to put it straight to you. Then I'm probably going to come to Steve to ask it at the second part. When will these features be available?
Love that question. We are looking to get this product out by autumn. So yeah, we will share some more information with a hard launch date, but autumn time is when you can expect it to be available.
And from a safety perspective, safety's actually just been released, so it's available to early adopters right away for incidents relating to people you're supporting. And then we will be introducing additional functionality for recording staff and service events and visitor incidents slightly later in the year.
Thank you both. Put on the spot and well covered. Thank you. Talk about transparency still. Paul, somebody asked a question around where does the cost data come from? Would we input the different local authority rates directly into the platform?
Yeah, I can see a couple of late questions coming in around a similar kind of theme. So we try and take those in the round. Yes, the short answer is yes. Like the question that we were asking at the end is, does that person have a package of funding in place? That's the input point for that. So yeah, you'd be inputting the local authority rate there. when we're looking at the other costs that someone was mentioning in one of the other questions, what's the cost based on? So if you need 10 minutes nutrition support by one staff member, what's that cost based on? It is your company rate. So there is a background area that you can add those company rates for the different roles that you have on the system, the ones that are around points of care, sort of interactions and points of support. And there was one further one on that. Oh, and it is configurable. It is configurable by home, but it's actually inherited from the org. So you set it at the organization level, but then if you need to change those rates at a particular home, London waiting or something like that, you can adjust those rates. So we try to make it as simple as possible to set up, but that you've also can get right in the detail if you really need to. And you need to adjust those rates in a particular service for a reason. Yeah, I think that covers, hopefully that covers a couple in one go. Oh, and yes, it will be pushing data to advanced analytics. Yes.
That's what I was going to ask you next. Yeah,
Oh,
it's got the analytical data. You
Yeah,
jumped the gun.
definitely.
It's all good. It's all good. This isn't a question, but someone's commented the data capture and ability to adapt or replace identifier information on safety is really helpful in my additional role as a DPO when I get SARS come in. Thank you. So love hearing feedback like that of where features can help people in their day-to-day roles as well. I think we're at the end of the questions. Nourish team, have I missed any crucial questions that we really needed to call out? Because there was a lot coming through and I may have missed one.
No, I think we're all good, but I would certainly welcome anyone to get in touch with anything more you would like to know about transparency. I'm sure the same applies for safety for Mark and the team.
Thanks, Amy. Well, let's talk about that next. What happens now? What would you do if you want to know more about these two products? Well, we're going to be emailing you all tomorrow. Anyone that's been in attendance of the session today will receive an email tomorrow, and in that email will be the recording, so you can refer back to anything you want to double check, or if you want to review. There'll also be a link in that email if you want to reach out and know more. So if you want to ask some more questions on a one-to-one with your account manager or with your customer success person, then there'll be a direct way for you to ask those questions, and we'll make a date to arrange a call with you. But just as a general point, thank you all for joining today, and B, answering such really quality questions to keep us on our toes. That's what this was for. I hope you found the session useful. I hope you're inspired as we are about what's to come in the future. And a special last thank you to Caroline and to Anna, who is our special guests today. So thank you all. Have a great afternoon, and I'm going to end the webinar now. Cheerio.